line was an absolute godsend to me. I don't know what I'd do without it.
You probably would have to stay in the hospital, but because I had the PICC line, I didn't. And it was nice because I was home, around my family, not in here.
I'll be honest, I mean, it was less painful than getting a regular IV put in.
It's not uncomfortable at all, and the maintenance is very easy.
A PICC line is a device that allows you to receive IV fluids and medications without the need for multiple needle sticks.
By having a PICC may allow you to go home when you might otherwise have had to stay in a hospital. It requires meticulous care.
A PICC line is much longer than a standard IV line and is inserted under sterile conditions by specially trained nurses or doctors. It can remain in place for weeks.
However, just remember, a PICC line is also a potential route for bacteria to enter the bloodstream, and this bacteria can cause serious infections. That's why the proper care of the line and its dressing is critical.
This video is designed to teach you and your caregiver how to properly and safely care for a PICC line. If you have a home infusion nurse helping you, please consult with the nurse for additional information.
To get you started, you'll be given some supplies to take home. We should point out that the supplies your home infusion company provides may be different from those used in the hospital or shown in this video.
Please view the entire video. Patience is essential. You can't rush the process of caring for your PICC without risking an infection or contamination.
It's important to regularly flush the PICC line. That will help keep it from clogging.
You must flush the line before and after medication is given, before starting and after ending an infusion, and after every 12 hours that the PICC line has not been used. First, we'll show you how to flush before and after medication or an IV infusion is given. You'll use what's called the SASH technique. SASH stands for saline, any infusion, whether a continuous IV or medication, saline, and heparin. The first step is to get your work surface ready. The surface needs to be cleaned with disinfectant wipes before you start. Cover it with a clean paper towel or Chuck's pad. For this procedure, you will need two 10 milliliter pre-filled normal saline syringes, your medication infusion, one pre-filled heparin syringe, alcohol preps or chlorhexidine swabs, a box of clean gloves, and a sharps container. The first step is to wash your hands with soap and water for 30 seconds and dry with a clean paper towel. Or use an alcohol-based hand sanitizer and let air dry. Put on a pair of clean gloves. Now we'll perform the first SASH step, saline. Remove the cap from the saline syringe. Apply gentle pressure on the syringe plunger to push out the air bubble. Clean the end cap, also called a hub, with an alcohol prep or chlorhexidine swab. You must scrub the hub for 30 seconds, allow to air dry. Then, using a clockwise motion, screw the tip of the syringe into the end cap of the catheter. Make sure to unlock the catheter clamp. Once the syringe is securely attached, flush the contents of the syringe through the catheter by using a gentle stop and start motion. You don't want to flush the entire syringe contents in one push. Vigorous flushing will damage the PICC line.
The saline should go into the catheter easily. If it's hard to push the saline in, stop and contact your doctor or home care nurse.
When you are done, unscrew the used syringe from the cap and discard it into the sharps container. Next is any infusion. With another alcohol prep or chlorhexidine swab, scrub the hub again for 30 seconds. Using a clockwise motion, screw in the end of the IV medication tubing. Now start the infusion. Remove your gloves, discard, and wash your hands.
Honestly, you just have to know how to follow directions. That's it. Just follow the directions. It's just so simple. It is.
It only takes a couple of minutes. You know, my husband was even there, and he when they showed him the first time, he picked it up right away. And I picked it up right away. It's not that hard.
I wasn't able to go back and bench press the gym and some things like that. But again, compared to lying in a hospital bed, I was able to be much more active and do a lot more things.
If I can do it, anybody can do it.
We put the medicine in her PICC line
I think it can help my mother feel better.
because she's got to be healthy and strong.